First responders from across the province have had a lot to deal with during COVID-19. Joel St, formerly of Niagara Falls, is a primary care paramedic in the Greater Toronto area, and he's here to give a little bit of the insight of what his job has been like during the pandemic. Joel, how long have you been a primary care paramedic?
I've been a paramedic for 4 years.
For 4 years.
Yeah.
So walk me through a little bit of your typical day of what it would be like on a call before COVID-19.
So we would sometimes be sitting at station if it was the start of our shift. There's tones that go all over the air through a locution system, and they tell us the priority of the call we're going to and a vague description of what the call is about. So maybe shortness of breath or chest pain. So we go down to the truck, we go to the call, knock on the door, who's sick, they bring us to that patient, and we assess them with our cardiac monitors. We attach everything on them, get a set of vital signs, and that was before COVID.
So now we're in the era of COVID. So what PPE do you need to do? What do you need to do to protect yourself before you go on a call?
So now for every call, I approach it with a surgical mask or an N95 mask if it's a respiratory issue. Mostly a surgical mask now. And before we enter the residence, we ask if there's been any travel, is anybody in the house sick? What are the patient's symptoms that we're dealing with right now? And it allows us to decide what PPE to use, whether we need full face shields and gowns, or if we can sort of approach with caution at first and assess the patient, see sort of what we need from then on.
So you're not actually leaving the station in full PPE. You're kind of gauging when you get to the call to find out what it is that you need. That way you're not going through so much PPE a day.
That's correct. And I've started reusing surgical masks and especially reusing the N95 masks. Unless I have a confirmed COVID patient or somebody who's been coughing, or if I'm performing any aerosol generating medical procedures, then I would dispose of all the PPE I was wearing. But for common calls, like if somebody's got a nosebleed or something, then I'll reuse that PPE as long as it's not soiled.
So about how many COVID calls have you had since this whole thing started in March?
When it first started, I was having at least 1 to 2 COVID calls per shift. And at first we were approaching everything with the utmost panic. We were putting on these hoods and goggles and N95 masks, these level 4 gowns. And it was really difficult to change the job over to that it put us into an area of discomfort when usually I'm walking into a call, I'm comfortable, everything's in my control.
Do you feel that once we're post-COVID that there's these experiences that you're having now are going to be staying with you and how you're going to be approaching calls for the future?
Yeah, for the foreseeable future, I'm going to have to be wearing a mask and safety glasses for most of the calls, because we've even had some family members who were scared that we weren't going to treat their family member right if they said they were sick or said they had COVID. So we've had family members lie to us, and then we find out from public health later that they had COVID and that we should monitor ourselves for symptoms. So leading into the future, I'm going to be having to wear a mask on every call just for that reason alone.
Have you seen an increase in calls of mental health? I mean, we've had lots of people at home now for the last almost 3 months. And, for those who may have not had mental health issues in the past, but now are still starting to experience some, have you seen those on the rise?
We've seen definitely some anxiety behind this. Like if anybody gets a scratchy throat, they panic and they'll call us. But I wouldn't say at the very beginning of this, we saw a severe decrease in call volume because people were sort of putting off their medical complaints and deciding whether it was worth going to emergency where you'd be exposed to COVID. So we saw a decrease, but now it's starting to climb back up and the call volume's right where it was at. But I would say, I wouldn't say there was an increase in mental health calls, but definitely a lot of calls where we show up and the person is having anxiety about the virus.
Well, Joel, best of luck to you and your colleagues and during this COVID time. And I know that must be stressful for you to be going into work, but the service that you're doing and the care that you're providing to the residents of Ontario is incredible. So we thank you for everything that you're doing, and stay safe.
All right. Thanks for interviewing me.